I want you to picture something very specific. You're walking to the mailbox, or you're 2 aisles into the grocery store, and there it is, that same tight, gripping cramp in your calf. Not a sharp injury, not a pulled muscle, just this deep, aching squeeze, like someone is slowly closing a fist around the muscle. You stop, you lean on the cart, or you sit down on the bench by the mailboxes, and within a few minutes, it's gone, completely gone, so you shrug it off. Just my arthritis acting up. Just getting older, I suppose. And you keep walking. Here's what I need you to sit with for a second, because this is the part that changes everything. That cramp very likely has nothing to do with your muscles and nothing to do with your joints. In a meaningful number of cases, what you just felt was your leg being starved of oxygen, a muscle screaming for blood it isn't getting. And here is the piece almost nobody tells you. The same arteries that are narrowing in your leg are frequently narrowing in the very same way near your heart and your brain, which means that harmless leg cramp may be functioning as an early warning system, a check engine light, for a much larger cardiovascular event down the road. This has a name. It's called peripheral artery disease, or PAD, and by the end of this video, you're going to know exactly how to tell whether that cramp is muscular or whether it's your circulatory system trying to get your attention. Here's why I felt this video needed to exist. In my own practice, I've lost count of how many patients described this exact cramp to me in passing, almost as an afterthought, while we were talking about something else entirely. Their blood pressure, their cholesterol numbers, a routine physical. They mentioned it the way you'd mention a stiff shoulder. And every single time, that offhand comment turned out to be the most important sentence in the entire visit. Not because the leg itself was in danger, though in advanced cases it can be, but because of what that cramp was quietly telling us about the rest of their circulatory system. I don't want any of you walking out of your next appointment having left that detail unsaid because it seemed too minor to mention. By the end of today, I want you to understand exactly why it isn't minor at all. Let's talk about why this happens, because once you understand the mechanism, you'll never look at a leg cramp the same way again. Think of the arteries running down your leg like a garden hose. When that hose is clear, water flows through easily, whether you need a trickle or a full blast. Now imagine plaque, that waxy buildup of cholesterol and fat we call atherosclerosis, has been slowly narrowing the inside of that hose for years, maybe decades, without a single symptom. At rest, the muscle in your calf doesn't need much blood, so even a narrowed artery can usually squeak enough through. That's why you can sit in a chair all evening and feel completely fine. But the moment you stand up and start walking, the muscle's demand for oxygen shoots up. It needs a fire hose, and the plaque simply won't let that much through. The muscle tissue downstream starts working anaerobically, waste products build up, and you feel it as cramping, aching, or heaviness. The medical term for this exact pattern is intermittent claudication. It comes on with activity, at a fairly predictable distance, and it resolves with rest, usually within 2 to 5 minutes of sitting or standing still. That specific rhythm, pain with walking, relief with rest, is one of the most useful clues in medicine, and it's the reason so many people get misdiagnosed. Before I go further, let me tell you who this tends to affect, because it isn't random. Age itself is a factor. Risk rises steadily as we move through our 60s, 70s, and beyond. A history of smoking, even decades ago, leaves a lasting mark on artery walls. Diabetes, high blood pressure, and high cholesterol all accelerate the same plaque-building process. And if you've already been told you have heart disease, or you've had a stroke or a mini-stroke in the past, your legs are sharing the exact same bloodstream and the exact same risk. None of this means it's inevitable. It means it's worth paying attention to, especially if more than one of those factors applies to you. I had a patient, I'll call her Margaret, 68 years old, who came to me convinced she had sciatica. Her previous doctor had actually agreed with her, and she'd been doing stretches for months. But when I asked her specifically, does it happen at the same distance every time, and does it go away completely when you stop? Her face changed. She said, actually, yes, every time. Right around the same fence post on my walk. Sciatica doesn't behave that way. It's usually there whether you're moving or sitting, and it doesn't reliably vanish with a few minutes of rest. Margaret's pattern was almost a textbook description of claudication. We checked her circulation, and sure enough, that's exactly what we found. The reason this gets missed so often in seniors is that arthritis, neuropathy from diabetes, and spinal nerve issues can all produce leg discomfort too, so doctors and patients reasonably reach for the most common explanation first. But when the pain has that on-off pattern tied directly to walking distance, it deserves a second look, because the underlying cause isn't a joint or a nerve, it's plumbing, and plumbing problems are rarely local. If the arteries feeding your calf have this much plaque buildup, the same disease process, atherosclerosis, is frequently active in your coronary arteries and the vessels supplying your brain as well. That's the connection I want burned into your memory today. A clogged leg artery is a strong signal that you should have your heart and your blood vessels evaluated as a whole system, not just your leg in isolation. I want to give you one more example, because PAD doesn't always look the same in every patient. I had a gentleman I'll call Walter, 74, who never described his symptom as pain at all. He called it a heaviness, like his leg was dragging a weight behind it after a certain distance. No sharp cramp, just a progressive fatigue in the calf that forced him to stop. That's an important distinction. Claudication can show up as cramping, aching, burning, or simply a deep tiredness in the muscle. The common thread isn't the exact sensation, it's the pattern, brought on by walking at a fairly consistent distance, relieved by rest. If you remember nothing else from this section, remember that pattern, because it's what separates a circulation problem from an ordinary muscle ache. Now let's go through the 4 warning signs I want every one of you to be able to recognize, because early detection here can be genuinely life-changing. The first is what I call the stop-and-go pain, the claudication pattern we just talked about. The key features to listen for in your own body. It happens during activity, specifically walking or climbing stairs. It tends to show up at roughly the same distance or the same number of steps every time. For one person, that might be half a block. For another, it might be the length of the grocery store. And critically, it eases off substantially within a few minutes of rest, without you needing to do anything else. If that describes what you've been experiencing, please don't file it away as just old knees. Bring it up with your doctor using those exact words. It happens at the same distance, and it goes away with rest. The second warning sign is what I call the ice-cold foot. Here's a simple check you can do tonight, sitting on the edge of your bed. Take the back of your hand and place it against the top of one foot, then the other. You're not checking for a big dramatic difference. You're checking for one foot that consistently, noticeably runs cooler than the other, especially toward the toes. When circulation is reduced on one side more than the other, that limb often loses warmth first, simply because there's less warm blood reaching the skin's surface. A one-sided temperature difference, especially paired with that stop-and-go cramping, is worth mentioning to your physician at your very next visit. The third sign is one that's easy to write off as cosmetic, but it's actually a direct window into blood flow. I call it the desert leg. When circulation to the lower leg and foot is chronically reduced, the skin there can start to change. It may look thin, shiny, almost stretched, especially over the shin. And here's the detail that surprises people. Hair. If you or a loved one used to have hair on the toes or the lower shin, and over the years it has simply stopped growing back, that isn't random aging. Hair follicles are small, oxygen-hungry structures, and they're among the first tissues to shut down production when blood flow drops. A leg that's gone smooth and shiny where it used to have hair is quietly telling you something about the blood supply underneath. Some patients also notice their toenails have become thicker or more brittle, growing more slowly than they used to. Another small tissue change that follows the same logic. None of these signs on their own are proof of anything, but taken together, especially alongside that stop-and-go cramping pattern, they start to paint a very consistent picture. The fourth and most serious sign is what I call the night ache and the gravity trick. In more advanced cases, people describe a burning or aching pain in the foot at night, even while lying still, that wasn't present earlier in the disease. And many patients, without ever being taught to, discover on their own that if they let that foot hang off the side of the bed, or dangle their leg down and let gravity pull blood into it, the ache eases. That single behavior, instinctively lowering the leg for relief, is one of the more telling signs that circulation has become significantly compromised, and it's a sign that should prompt a call to your doctor soon, rather than eventually. If any one of those 4 signs sounds familiar, I want you to remember one phrase to say to your doctor: I'd like an ABI test. That stands for ankle brachial index. It is one of the simplest tests in all of medicine. Your doctor or a technician takes a blood pressure reading at your ankle and at your arm using an ordinary blood pressure cuff and a small handheld Doppler device and compares the two numbers. The whole thing typically takes about 10 to 15 minutes, involves no needles, no dye, and no discomfort beyond the normal squeeze of a blood pressure cuff. The ratio between those two readings gives your doctor a strong indication of whether blood flow to your legs is reduced, and if the result is abnormal, they can follow up with imaging like a Doppler ultrasound to look more closely. This is not an exotic or expensive test. It is widely available, and it can be the single conversation that changes the trajectory of your health. I also want to be upfront that walking and lifestyle changes aren't the only tools available. So nobody watching this thinks their only option is to grit their teeth through pain alone. Depending on how significant the blockage is, your doctor may also recommend medications that help blood flow more easily or manage the cholesterol and blood pressure driving the plaque buildup in the first place. Quitting smoking, if that applies to you, is one of the single most protective steps you can take, and your doctor can help make that easier than doing it alone. In more advanced cases, where a limb is genuinely at risk, there are procedures, ranging from a minimally invasive angioplasty to open surgical bypass, that can restore blood flow directly. The path forward really does depend on your specific situation, which is exactly why that first conversation and that first ABI test matters so much. You are not choosing between ignore it and major surgery. There is a whole spectrum of options in between, and your doctor's job is to match the right one to you. Now here's the part of this video I actually find hopeful, because PAD is not a life sentence, and in many cases it responds remarkably well to something you already have access to: walking. I had a patient, I'll call him Harold, 72 years old, who was diagnosed with PAD after describing almost exactly the pattern we just covered. His instinct, understandably, was to avoid walking altogether, because walking is what caused the pain. But under his doctor's supervision, we did the opposite. We started him on a structured, supervised walking program. Walk until the cramping starts, rest until it eases, then walk again, gradually building up distance over weeks and months. This is often called supervised exercise therapy, and it works through a genuinely fascinating mechanism called collateral circulation. When a muscle is repeatedly pushed to the edge of its oxygen supply under controlled conditions, the body can respond by growing small new blood vessels that route around the blockage, essentially building a natural bypass. It doesn't work instantly, and it isn't a substitute for your doctor's evaluation of how severe the blockage is. Some patients will also need medication, and in more advanced cases, a procedure to restore blood flow directly. But for many people with mild to moderate PAD, consistent, doctor-supervised walking is one of the most effective tools we have, and Harold's own walking distance improved substantially over the following months. The body, when you train it properly, can build its own workaround. What struck me most about Harold's case wasn't just the distance he gained. It was watching his confidence come back. He'd spent months quietly avoiding walks with his wife because he was embarrassed about having to stop. Once he understood that the stopping itself was part of the treatment, not a failure, he stopped avoiding it altogether. That shift in mindset, from fearing the pain to working with it under proper medical guidance, is often just as important as the exercise itself. So here's what I want you to take from today. That cramp in your calf, that cold foot, that shiny hairless shin, these are not simply signs of getting older. They may be your body doing you an enormous favor, flagging a problem in your circulation while there is still time to act on it. The fix starts with one phone call and 5 words. I'd like an ABI test. I know videos like this one can feel heavy, even a little frightening, and that was never my intention. My intention is the opposite. I want you to feel equipped, not alarmed. Most people who bring this up with their doctor early go on to manage it well, stay active, and keep doing the walks, the gardening, and the trips to see their grandchildren that make life worth living. The only version of this story that worries me is the one where the cramp gets waved away for another 5 years. You already have everything you need to prevent that version. You just have to make the call. If this video gave you even one thing to bring up at your next appointment, do 2 things for me. First, subscribe to Senior Health Guide, because we cover exactly this kind of practical, life-protecting information every single week. Second, and this matters more than the subscribe button, share this video right now with anyone over 60 in your life who's ever complained that their legs hurt when they walk. It might be the most important share you make this year. And before you go, I want to hear from you. If today's video gave you a renewed sense of vitality, or if you're committing to your own independence by having this conversation with your doctor, drop that word in the comments below. I read every single one. I'm Dr. David Thompson. I'll see you in the next video.